Hi everyone, Dr. Heather Peterman here. It's early on a Saturday morning and I'm outside taking some me time and just reflecting back on my week and really just feeling grateful and reflective about where I am right now. And it got me thinking about a lot of my acupuncture colleagues and friends and a lot of people that I know through the forums and just kind of through contact throughout the US. And really kind of put me in a reflective state of how I got to the point that I'm at now, and what the paradigm shift was for me that really changed me from being a person who was very stressed in practice and very worried about my future and how things were going to roll out. I used to be someone who, despite running a pretty successful practice, had a lot of anxiety and a lot of weight on my chest. So Saturday mornings for me didn't used to be so enjoyable. I didn't used to have this time to take some reflective time and some self-care time where I could really feel good about where I was. Instead, I was pretty laden with anxiety and worry about how my week would look like, about how many patients I would see, and really where my next patients would be coming from and how I would keep my practice afloat. I had a couple different acupuncturists working for me at the time, and I was worried about how I would pay them, how I would pay myself. Despite having a pretty heavy patient load, I still had a lot of financial worry. And now kind of moving into a place where I've got a lot of freedom and I feel good and I feel secure. And I've really gotten to a point that I define as being successful as an acupuncturist. I'd like to give back to the acupuncture community and talk with you guys about what you can do to shift that paradigm for yourselves. So looking at that, I think we can define success, especially as an acupuncturist, on a lot of different levels. So a lot of you are successful practitioners, meaning you have great patient results. Your patients that are with you follow you. And you do really well with the patients that are within your doors. But I'm wondering, and I know that there's not a lot of financial success out there as a majority as acupuncturists. I see far too many acupuncturists closing their practices, especially now that we're in the middle of the COVID pandemic, and we had so much time where acupuncture practices had to close down. I see the heartbreaking reality of people deciding whether or not they can continue on in this profession. I see people who have a passion for what they do and they're fantastic with their patients, but they just can't make those ends meet, and so they're leaving and going into a second or third career with the debt that they still carry from acupuncture school, and that's just not okay. So defining success in different ways. Are you successful as a practitioner with your patients? Are you financially successful? And what does global success as an acupuncturist mean? And when we take a step back from that and we try to look at how do we achieve that full-blown success, what I see is the trends in integrative medicine. And I want to talk to you guys about shifting the way you practice. So I think too many practitioners still practice only from an Eastern standpoint. So I see websites all over the place that are talking about what is chi stagnation, what does acupuncture do? Acupuncture is a modality or a system of medicine that's 5,000 years old, and we use solid one-use filiform needles, and it's the same spiel over and over and over again. And I think practitioners, I think patients, and I think providers are inundated with that, and it doesn't do anything to make you stand out. So people kind of get the buzz of what acupuncture is, and I think now we need to shift it into acupuncture not just being an alternative or complementary practice, but acupuncture being a very valid, evidence-based model of medicine that can be integrated into conventional care to form this integrative approach. And when we do that, when we shift the way people are looking at us from alternative or complementary, we become essential. So now we're partners with their conventional providers. It's not that patients are choosing between going to their primary care physician or their acupuncturist. They're choosing a healthcare team that's there for them. But to make that shift and to put yourself in that position where you become an essential partner or an essential provider, it's necessary for you to shift the way you present our medicine and the way you talk about our medicine. Now, I'm not saying we shouldn't honor our roots. I'm not saying that we shouldn't absolutely use our classical diagnostics and stick with kind of the purest form of how we practice medicine. I'm saying that we need to change how we present it and come up with language that provides the correct communication to the Western community and to providers and patients. So how we do that, really, I'm going to tell you guys the buzz thing that's out there in integrative medicine, and the thing that's really going to get attention is the biopsychosocial model of care. So this is what we kind of formally referred to for all these years as mind, body, spirit. Now the Western and conventional settings have kind of realized that yes, this works. Let's kind of make it a little bit more appropriate for where we practice, and they've turned it into the biopsychosocial model of care. So this is nothing new to us. I'm not asking you to change how we think, because this is a complete system of healthcare, but I'm asking you to change how you present it. So when you talk to physicians and you talk to patients about us working in a biopsychosocial model of care, what you're doing is saying we're not just addressing symptoms, we're not just addressing mental health, we're not just addressing what you're physically feeling, we're addressing your whole body, your complete body, and we're doing that by using evidence-based modalities. So when I kind of put that into a spin for you guys, so I talked about in my last video how we talk about pain and how we address pain. So I'm going to go a little bit deeper with that. So we've learned in the last video that if you're going to talk to a physician about why they would refer people to you for pain, you're going to hit on things that they can't meet. You're going to hit on why it would help them reduce the amount of pain medications that they prescribe, why it would help them free up their time by taking some of those patients who are a little bit more complex off their hands. Now, when you talk about the biopsychosocial model of care, you can start to talk about things like regional pain complex. So there's absolutely a phenomenon called symptom shifting. And that's what we see with our patients when they've lived with a condition for a long time and they see a physician or they see us and we successfully treat one symptom, but now they start to have pain somewhere else in their body or another thing pops up. So that symptom shifting occurs when there's an underlying psychological component to their pain. And it's kind of that same philosophy of issues in the tissues, so that person is never going to actually start to heal or get 100% better until you deal with that psychological component. And the selling point for acupuncture is that if somebody's coming to see you for acupuncture to address pain, you're going to help release all those endogenous hormones, all those endogenous opioids that decrease the physical symptom of pain. But you're also going to work on their psychological state by releasing dopamine and serotonin and giving them a way to process emotional trauma or turmoil internally without needing to talk through it. So without needing to go to talk therapy and talk through it. And when you start to resolve the psychological components of pain, then you really start to heal and this person starts to get better. So when you explain this to a physician, physicians absolutely know that this exists and it's something that they can't really hit on. So it gives us an extra piece of something that we're doing that they can't do. And we can apply this to anything. We can apply this to fertility when we talk about treating stress, which is where most REs will bring you in, is to treat stress. But we can also address what happens to the body, because the heightened level of stress creates a heightened level of cortisol, and cortisol can kind of disrupt how their treatments are working. So again, biopsychosocial model. We can apply it to pediatrics and children's health when we talk about the increase in the obesity epidemic and how that's creating childhood pain and how that's creating overdoses and just horrible problems with children and addiction. Again, going back to that biopsychosocial model is going to give providers and give patients something that they can hold on to and something that they can understand, and it sets us aside, it sets us out. So when we're talking about achieving the next level of success, when we're talking about getting that financial freedom, that point where we can enjoy our Saturdays, where we can enjoy time with our kids without worrying about where our next patients are going to come from. You really need to do that by setting yourself aside. You can't be another acupuncturist out in the sea who's talking about liver chi stagnation and who's talking about how old our medicine is and how beautiful and complex and natural it is, because honestly, guys, no one cares about that at this point. What they care about is what's in it for me. How do I get the results? And how they do that is with the biopsychosocial model of care that's so prevalent in integrative medicine now. So you guys can follow me if you want to learn more about this. I have a PDA website, Purple Elephant PDA on Teachable. I have lots of classes there, and we'll be adding new classes to the library all the time. So that's really going to dive in and take you into the how-to, identifying the what, identifying the how, and really putting a plan of action into play to get you where you need to be. You can follow me on YouTube here. I'm going to keep on putting a lot of videos up, so please like, subscribe, and share my channel. My goal is to really get this message out there to acupuncturists and help elevate our profession. So please, if you like what I'm saying, share. And you can always follow me on Facebook too, Heather Henry Peterman, or you can follow me underneath my Purple Elephant professional page. So please help get this information out there in the hands of other providers so that we stop losing wonderful, successful acupuncturists who just are missing that business piece and missing the language piece. And let's get everybody to a point where we can enjoy our weekends, we can enjoy some stress-free time, and elevate ourselves to where we really truly should be as practitioners and as professionals. Thanks for listening. I'm Dr. Heather Peterman. Please like, share, and follow my YouTube channel here. Thank you. Bye-bye.